Hey everybody, Dr. Rob here again, Facebook Live. Great topic today, leading edge, cutting edge. All this information came out on all the major journals yesterday. Chiropractors, alternative therapists, manual therapists, share this with your patients. Share this with other doctors. Do us all a favor, get the word out. I have a young lady standing here right now. She works with me and she helped me write all the information here. And she said, Dr. Silverman, very simply, who knows this? None of your patients know this. Our patients need to know this. Share this with everybody out there. We're going to be talking about lower back pain. But what is the answer for lower back pain? Alternative methodologies. Lower back pain. 8 out of 10 Americans every day, or 8 out of 10 Americans in their life, have lower back pain. It is a $765 billion healthcare cost, a debt to our healthcare society right now. 8 out of 10 Americans have lower back pain. Interestingly enough, the idea of chronic disease means you can't be cured by a vaccine or aided by a drug and you have it over 3 months. Number 4 on the list of chronic disease, after cancer, stroke, heart disease, arthritis and musculoskeletal, lower back. So let's talk about it a little. Yesterday, the American College of Physicians published an updated guideline in the Annals of Internal Medicine. Guess what they found? No more medications as a first-line therapy for lower back pain. So what do most patients go to do? Unfortunately, they usually go and they ask for a drug, an opiate. They go to the pharmacy. They go to their cabinet and they look for Aleve, Advil, Tylenol, and the like. Obviously, they're going to the doctor for a pain opiate. No more. No more. The Annals of Internal Medicine said it does not work. Not even over-the-counter pain relievers. Anti-inflammatories are a choice. Pain reliever being Tylenol. Over-the-counter anti-inflammatories being NSAIDs, non-steroid anti-inflammatories, ibuprofen, Aleve, Advil. They no longer are choices for people. Everywhere I go, when I travel, anytime I say I have an ache or a pain, just to test it out, when I walk into a hotel, hey, Dr. Silverman, it's 11 o'clock at night, the night before I'm teaching a seminar. How you doing? And I'll say, hey, I got a little lower back pain from riding in a plane. My lower back is fine. And they go, oh, I have something for you. And they give me Aleve or Advil. Can you believe that? Nobody offers me a green drink, a probiotic, a fish oil, a specialized pro-resolving mediator, which resolves inflammation. They're offering me these pain relievers and anti-inflammatories. So, from a quote from the lead investigator, he said, we need to look at therapies that are non-pharmacological. This is a massive change. They have to look at therapies that are non-pharmacological first. Chiropractic, physical therapy, acupuncture, massage, personal training. Lifestyle. Change your lifestyle. One of the best programs I've seen to change their lifestyle and incorporate exercise and adjustment is my friend Dan Donahue's, Dr. Donahue's 8 Weeks to Wellness. Big shout out. He does a great job with that for chiropractors. So let's move on. Let's cover a couple other interesting topics. Here are your new guidelines. Number 1, avoid prescribing opiates to the doctors. No more pain opiates. They've found out that too many people are getting hooked on these opiates. I can't tell you how many patients come in and go, should I take a drug? Should I take this, oxycontin, etc.? And I'm like, no. It's putting a Band-Aid on a bullet wound. It's looking to help a symptom when we are all, without questions, looking at systems, not symptoms. Therefore, we can get to root cause resolution. That's all about my book, Inside Out Health, A Revolutionary Approach to Your Body. In addition, avoid painkillers for relief of back pain. Tylenol does not work. Not only doesn't Tylenol work for pain, it's a pain and fever, it causes 20% of the adult population to have elevated enzymes, liver enzymes, and that's why they go to the hospital. Tylenol is just basically poison. Go take some arsenic, guys. Come on, forget the Tylenol. In addition, it's suggested before patients buy anti-inflammatories or muscle relaxers, they should try alternative therapies. How many times have patients walked in my office and my brethren chiropractic offices and said, yeah, I've been trying to leave an Advil for the last 3 weeks. I wanted to see if it would go away. I wanted to see if it would help. Non-steroid anti-inflammatories, which is just what we said, do decrease pain, but they impair healing. Nutraceuticals, which I will recommend and tell you which ones to take, decrease pain and promote healing. Which do you want? Non-steroid anti-inflammatories, Aleve. These anti-inflammatories, Advil, ibuprofen, don't allow for joint cartilage synthesis, do not allow for muscle hypertrophy, do not allow for bones to heal, and unfortunately they also damage your gut, causing leaky gut, meaning specific things can pass your gut and they flow into your blood system, and therefore they cause systemic inflammation. Just from trying to modulate some pain when you're not getting the bang for the buck in the pain. They're now saying no. So let's move on. Let's cover a couple other new guidelines. It gets better. Not helpful steroid injections, epidurals. Should I take an epidural? Not an epidural if you're giving birth. We're talking about an epidural for lower back pain. They're saying not helpful for lower back pain, or specifically non-sciatica lower back pain. Hey, should I get an epidural? And then you have to take 3. No. Try chiropractic care. Try some physical therapy. Try some acupuncture. Try some naturopathic. Try these what we call alternative methods. In addition, ready for this? Physicians should consider opiates as the last option for treatment only in patients who have failed other therapies. So what are they saying? Go to the chiropractor first. Number 1, if it doesn't work with the chiropractor, after making a commitment and giving that person 6, 8, 12 visits to see if they can modulate your pain and get you healthy and moving better, then you can start considering some of the anti-inflammatories. And then you can also start considering, at the very end, the pain opiates and the epidurals. Not 1 visit, not 2 visits. You know, it took a while to get your pain. You have to understand it may take a while for it to go away. And let's take a look at what was suggested by them, and I'll give you some big suggestions. Number 1, exercise. Everybody's got to move. Sitting is the new smoking. So we found out that people sit 30% of their day, look at technology, 41% of their day, and only exercise 0.69% of their day. Sitting is the new smoking. Now, I'm always standing, but if you notice, I'm moving, because standing and moving is better than just standing. So we got to move around. But the big takeaway was motor control. What do they mean by that? Motor control means proprioception. We did a health tip last week on proprioception. Proprioception is your balance between your nervous system and your muscular system, therefore practicing with balance. Something we talked about before called altered motor control. After an injury, you're going to move in a different light, and your brain's going to accept that new movement, which is aberrant or improper, as correct movement. If you don't retrain new movement, you've now trained your body to move improperly. With that training of moving your body improperly, you're always going to move improperly and start to break down. Movement is life. It is complicated. So one of the biggest things you can do other than exercise is go to somebody who does a functional movement assessment. We do that in the office. Someone who analyzes how you move, analyzes how you sit, analyzes how you bend, analyzes how you do your activities of daily living, analyzes how you perform your sport. Breaks in movement will release more acid than any food that you can consume. Therefore, can be extraordinarily deleterious to your health. It's all about exercise. It's all about motor control. Number 2, you guys haven't heard me really talk about this ever. Spinal manipulation, adjustment. Wow. Oh, my God. I went to a chiropractor. I was told not to go because the chiropractor can hurt you, adjusting you. Why don't you show me a study where that happened? I took a pause. Show me some studies where that happens. Spinal manipulation done by a professional has a very, very low risk. Not no risk, but low risk. Spine Magazine in 2013 said the number 1 choice for lower back pain, by far, 73% effective, chiropractic treatment. The next treatment we won't mention, 17%. Spine Magazine, Orthopedic Journal. The Journal of American Medical Association in 2014 ran the same study. That's primary care physicians. So why isn't everybody recommending chiropractic for lower back? I do not have an answer. All I can say is, you the people, you the chiros, you the alternative practitioners need to start talking about this and get on this health revolution and this mission and explain who are the people to help. Chronic disease, as we talked a little bit about on previous Facebook Lives, is one of the biggest issues. It's a $2.3 trillion issue on our healthcare cost. And one of the biggest ones is musculoskeletal. And I think functional medicine docs, like the chiros I know, and the other alternative natural paths and acupuncturists I know, are the key components and the captains on helping people decrease healthcare costs and chronic disease. Acupuncture. I don't do acupuncture. I don't have an acupuncture license. Got a lot of friends that do acupuncture. Dry needling and such, great choice. Helps the body from within, inside out, if you will. Massage and soft tissue. Massage is great. Soft tissue techniques that I recommend. Active release technique, a patented soft tissue technique pointed at breaking up muscle adhesions and fascial planes, fascia being the top part of the body, and also breaking up nerve entrapments. Instrument assisted techniques like Factor. Big call out to Factor. Todd Riddle does a great job. Dr. Tom Hyde. Those are two gentlemen that are outstanding with this instrument assisted soft tissue technique. Highly, strongly recommend that. Pick a practitioner that does some instrument assisted and or hands-on techniques. Yoga. Well, as you guys probably know, with my type A personality, I'm not a yogi. But I think yoga is great. But I think the yoga really goes to the idea of flexibility and relaxation. So they're saying if people would stay a little calmer about their pain and not lose their mind, so to speak, about it, they'll have a better clinical outcome. And flexibility of the joints. Little takeaway about that. It's not just flexibility. It's stability in a joint. The stability between the muscles so they're balanced. So once that joint is stable, it will look mobile. That's how much I move it and how flexible it is after that. So stability, mobility, flexibility, yoga should enable you to do that with some other additions. And finally, and not least, low-level laser. Best laser on the market as far as I'm concerned, Arconia laser. Big shout out to my Arconia family out there, Charlie and the rest. You guys do a great job. A class 2 laser. 14 FDA clearances. Low-level laser. Mimics a light, 635 nanometer light, like visible light. It gets pointed at the body absorbs it, the cell membrane takes it in, and you have a cellular physiological response that heals the body from the inside out. There's no heat, there's no oscillation, there is no vibration. I don't want heat. I like what the light laser does. Phenomenal for lower back, phenomenal for muscle, decreases pain, increases range of motion, and use it on people who have concussions. A great call. Arconia is my choice. If anybody has any questions about any of the things that not was just suggested by me, but suggested by the physicians in yesterday's study. By the way, New York Times carried it, Wall Street Journal, NBC News. John, did I miss anybody? Did you see a couple others?
There are a few more. I got to figure out which ones though.
There's at least 6 different journals that's talking about this. This is a game changer for everybody. Share it. Let everybody know about it. Because when the patients know about it, you will be busy and you will have that commitment for the patient that every one of us waits every morning up taking, don't call me now, call me later. Come on, I'm on Facebook Live. Joanne, that was you, right? Mm-hmm. Nevertheless, John, do we have any questions?
Yeah, so for someone who comes in to visit you with lower back pain, mm-hmm. what's the process like? How often are they coming back? What would you do to help them?
Great. If you're coming in for lower back pain, we have a full intake form that we have you fill out. I want to look at your history because the history is really going to be very revealing. I want to see, have you had an injury before? Have you had a concussion before? How many times you've been treated? Are you taking medication? What's your weight? We're going to weigh you. We're going to see your body composition. Are you too obese? Are you little, do you need to lose some weight? Because fat is inflammatory. We're finding out that people are very heavy, they're very inflammatory. When they come in, they get a movement screen. I see how you move. I want to make sure that you're moving in an appropriate way. We're going to do orthopedic and neurological tests to really ascertain the structure that's going on. We may take blood tests. We now have postural assessments, and in our postural assessment, we're going to take a look and see how you stand. Posture is a shadow of movement. And then, of course, the treatment's going to vary. We have traction, we have laser, we have soft tissue, we have spinal manipulation. And I didn't say it before, and it's a great question. What's your option instead of Aleve and Advil? Well, guess what? I'll give you a few options right now. Specialized pro-resolving mediators, which I get from Metagenics. I happen to like them very, very much. They resolve inflammation. You can see me talk all about them at Integrative Health Symposium in the Grand Ballroom next week. In addition, turmeric, curcumin, boswellia, quercetin, things of that nature are great natural anti-inflammatories. Alpha lipoic acid, a hidden gem, all of which help heal, decrease inflammation, and help heal pain.
What exercises should people avoid to protect their lower back?
Great question. What exercises? Number one, no more sit-ups. Please do me a favor. They're good for me because you hurt your back, and I don't want you coming in. They're bad for you. Sit-ups cause a break, flexion, bending at the lumbar spine. Not a good choice. They damage the disc. They also tighten your hip flexors, which are here, your psoas, causes lower back. No more sit-ups, no more crunches. Remember, your core should hold steady, stable, not move, so your arms and legs can move. No sit-ups, no crunches. Stop bending your back when you're trying to isolate your rectus abdominis, or if you will, your proverbial six-pack.
And the last one, for people who are lifting heavier weights, do you recommend a back brace of any sort?
Okay, so those who are working out really heavy for your max lift, I recommend the belt. Push against the belt. That'll enable you to engage your brace a little higher, harder, stronger. Other than that, I don't like a back brace any way, shape, or form, because I like you to have to be able to contract your core on your own and get your subconscious working, so your core is working 364, 24/7.
There you go. How can people find you?
They can all find me. You guys know how to find me on Facebook. Info at Dr. Robert Silverman, 914-287-6464. Share this information. Always yours in health, Dr. Rob.